Right. So let me then introduce our esteemed speaker who is joining today all the way from California, USA. And I would actually welcome, and I'm very thrilled to have him with us today, Dr. Raman Bhargav, who is a physician, an engineer, a writer, and entrepreneur who has spent years distilling complex systems and has been in multiple startups in the US. He brings a unique universalist perspective on AI and its use in healthcare. Follow him at Universalist MD. I'm going to put that in the chat box on LinkedIn to get his regular activities on various topics, including AI, as well as updates on his upcoming book. So I'll be also looking forward to read that book, Dr. Raman Bhargava. So with that short introduction, I would like to welcome Dr. Bhargav Raman on this platform. And please go ahead. Thank you.
Hey, very, very excited to be here. And it's a great thing nowadays that we're able to have so many people from so many different areas in the world, and the AI is it's going to affect everyone, and it's affecting people who are just poor farmers in India, all the way to the biggest healthcare institutions in the US, and it's a big deal. We have to be very cognizant not to believe all the hype that's coming up. But at the same time, we have to understand that this is a game-changing time for all of us. In healthcare, the AI was at least sort of a solution looking for a problem, and was like that for a number of decades. Um, and now with generative AI, we can really start to replace a lot of the previously human activities in healthcare. Because before now, early neural networks, support vector machines, these kinds of lower level AIs were not really able to, replace the human in any way, shape, or form. And as a bit of a history on this, right, the first real large scale implementation of AI that I know about is in breast cancer detection, where you have these computer aided detection companies. And there was a big push, big implementation, but the results are actually kind of mixed on whether it improves final outcomes in breast cancer. So, we need to be very, very cognizant of all this. That said, I tend to split healthcare AI into two different pieces. One is mainly administrative, right? And one is cognitive. And the administrative part is being, for the most part, right now, being duct tape in healthcare, right? Because we have a lot of different types of systems in different clinics in different hospitals in different countries. And AI is helping bridge the data sharing gap, data availability gap, because of these heterogeneous systems. Um, and in the future, we won't need to spend a significant amount of time trying to standardize data formats and things like that, because AI can just aggregate data when we need it to, for example. And suddenly now we can share data from Europe to the US to here. Are you able to hear me, Syed? I just saw a chat saying I need to raise my voice. I'll move the. Can you guys still hear me? Oh, I can't hear you, Syed. I think you're muted.
Yes, I can hear you very well.
Okay, all right.
I can
I
hear
just
you
saw
very
a
well
chat.
too. Yeah, please go on.
Okay, yeah. Sorry if you're not able to hear me very well. Okay. Yeah. So like I was saying, so the administrative part is mainly duct tape, right? The other administrative part is the summarization of the significant amount of data that's coming in from lab values, from the transcription, from the clinical note, um, and being able to bring the relevant, important data up front to the clinician so it's not missed. Um, and also to provide an overview for the clinician so that you don't need to spend 20 minutes before the um, before the appointment, trying to find out what happened in the hospital, right? You should be able to get a quick summary as to what happened in the hospital before you see the patient. So that's the other administrative piece that I think has high value. On the cognitive side, that's pretty early on, and it's pretty early right now. And the places where it's really being used is in the clinical decision support space. We might talk about this later, but there are applications like open evidence, which is at least in the US being used pretty broadly by clinicians to look up evidence for things. There's another startup called Glass Health that's also doing the same thing. Um, and eventually these kinds and eventually these kinds of clinical decision support will just get integrated into the electronic medical records that people use. Um, and it'll start from there, and then eventually we'll be doing a lot more um, uh, cognitive assistance. I'll call it for the physician. Syed, you're on mute again, I think.
Sorry about that. For the benefit of the audience who joined late, uh, that was Dr. Bhargav Raman, who has just given an overview of AI or artificial intelligence in healthcare domain. And now I'm going to open up the discussion with him and on some key topics that are relevant as to how AI or artificial intelligence is being used in healthcare sector. And then I'll leave about 15 to 20 minutes for question and answer from the audience. So I'll have about 25 to 30 minutes with him, and then I'll leave about 20 minutes or 15 minutes for questions from the audience. So if you do have any question, then please put it in the chat box, and I'll read those questions one by one to Dr. Bhargav. Okay, so let me start with very simple. Some of the attendees here or the audience may be naive to AI or artificial intelligence. So for that sake and for their benefit, could you please just explain the basics as to what exactly AI or artificial intelligence is, and also how it is being currently utilized in healthcare? I know there's a lot of utilization, but some of the basic ones which everybody should be aware of.
Yeah, so I'll give you. I mean, firstly, obviously AI is not new. Has been around for decades and decades. I first got into AI when I was looking at a game where I was teaching a mouse how to find cheese inside a maze, and that was very early version of a neural network. And basically, neural networks are ways of mimicking how the brain actually works. And it doesn't do that exactly, but the idea is to mimic it. And if you think about like what's happening now, it's basically a really large implementation of what's been there for decades already. Really large, very extremely scaled implementation of these neural networks and deep learning algorithms. Um, so if you think about it, it's a little bit like going from the mouse to a human, the evolution over the past 25 years. Um, and there are different levels of what we might call AI. And AI has been overused in many different things, but the lowest level is really your knowledge-based system, what we call as what basically means is you look at something like the Leeds University, abdominal pain, algorithm that was implemented decades ago. Um, that a knowledge-based system. Someone sat there and wrote an algorithm that mimics how a clinician thinks through a particular process, and then the computer basically, goes through the flow chart, one by one, asking questions. That's sort of the lowest level, right? And the next level is when you have a little bit of reasoning in there where you can go a little more eccentric to that, to that flow chart, right? You can start to understand, oh, when does this patient doesn't not meet the expected, um, uh, set of symptoms or signs. Then you get all the way to as you keep going, you get to something called artificial general intelligence, which is something that Google and a lot of people in the US are working on. And artificial general intelligence is essentially supposed to be human replacement. Um, and before, we used to think that AGI needs is just a matter of scale. We just get more and more graphics cards and stuff, and then eventually you'll get artificial general intelligence. But recently we've started to see that that's not the case. So, we are not there yet, but we will get there. As far as AI in healthcare is concerned, I mean, we talked a little bit about about where it's being used right now. Like I said, most of the time, most of the companies, they're going down the administrative route. That's where you can gain the most value. That's why doctors really want AI to do stuff for them, because it is a waste of time. The cognitive load is the doctor's job. It's not, you know, but writing an order is not the doctor's job, right? Thinking of writing the order is the doctor's job. So, and so the whole, so I think that's where you'll see the maximum amount of adoption in AI is just reducing administrative load. The effect of that will be that as a doctor, hopefully, um, you'll be able to go out and rent a office somewhere, and you won't need to hire any staff. Everything, the AI will do everything else for you, and all you need to do is see your patients, right? That would be the dream.
Yeah, I think I was just going to touch upon that point because, there is a palpable fear or nervousness in the minds of doctors that they probably will be replaced by AI. And I feel confident in my mind that probably that's not going to happen anywhere soon. And I think you have already touched on this subject, that on the contrary, we know that we doctors, we wear many hats. So we are responsible for the clinical work, the administrative work, teaching, some of them do research, and so on and so forth. So essentially, what I feel, and then I'd like to hear your opinion, if at all the others will be replaced, and we know for nurses, like 50% of the work nurses do is documentation and writing notes, which I feel is a thankless job. A lot of notes are not read. But again, it's a legal duty that we know that what is not written or documented is supposedly not done. So that's fine. But this may change again. Now, we are still not there. So how long do you think that stage will come that a lot of our work will be done by AI and the doctors who are being burnt out very easily in the current era? So that situation will change. How long do you think that will take?
Uh, you know, I'm always a conservative on these kinds of estimates, but things are moving very fast right now, and in terms of giving that like year estimate, it really has to do with, well, are we solving the right problems right now? Right? Are these big companies, well-funded companies, are they actually solving the right problem? And I think they are. They're overvalued for sure, but they are solving the right problems at this time. So the question is, who has the vision to create that integrated system that integrates all of this AI, so that we reduce the doctor burden rather than increasing it. Because as with a lot of other technology implementations, including EMR, you can easily increase the doctor workload, right? So, for example, let's say we replace the call center person with an AI, right? That always answers. There's no wait time, nothing, right? Utilization of that call center will go quite the ways up. Now, who's going to supervise all those patients, right? And all those patient encounters that occur over the phone with the AI? Yeah, it has to be the physician, or it has to be a nurse or something. So when we really think about, okay, is AI going to replace doctors or take up a lot of cognitive role? I don't think about it that way. I think about it more like the Industrial Revolution, right? Where now you have a tool where you can take care of many more patients in the same amount of time. Um, and the tool helps you do that, and you are guiding the tool. You're using the tool to do that. And I think, we have significant shortages, all over the world, right, in terms of medical care. I really don't think we're going to get to a point where AI is going to replace doctors entirely, but it is going to scale us a lot.
Sure. Okay, so on a similar note, we know that AI is still not perfect. It is still learning, and it is likely to make mistakes. Now, God forbidden, if mistakes do happen, errors do happen, and we know that healthcare industry is a high stake. There is risk for patients, and if God forbidden any error happens or a patient comes to harm, then who is going to be responsible? Is it the AI or the AI developer or the doctor or the healthcare professional?
Yeah, it's a very interesting question, and I wrote an article about this a little while ago, but the you just have to look at how doctors are being augmented or replaced now. So we increasingly patients are being seen or even primarily being taken care of by advanced practice providers like nurse practitioners and physician assistants. Um, and although I'm not calling them AIs, you can see that trend as an indicator of how the liability shift is also going to not occur, basically. Because when you're a physician, you're supervising nurse practitioner or PA, it's your malpractice. You're the one who's going to get sued because you signed off on that note. Um, and yeah, so and nowadays, I mean, in the US at least, the level of supervision is very low. And they just taking that malpractice risk, right? That's kind of what's going to happen with AI, but at a much larger scale, you know. Now, to the extent that the software developer will get sued, that's um, that's when the AI is doing independent decisions without supervision. That's when they can get sued. So, for example, you know, um, there's an application that calls a pharmacist or something, calls a pharmacy in the middle of nowhere to put in a prescription, for example, and then it gets the prescription wrong. That's when the software developer gets sued, right? So it's a question of when there is supervision and when there isn't, in terms of liability risk. Um, and that said, everything so someone gets the blame when there's an error, right? The question is who's primarily responsible for that being accurate.
No, very true. I agree with that. And I think it's just like driving AI-driven car, but keep your hands on the wheel to avoid any accident.
That's right. Yep.
Right. Now, on a similar note, I believe, as I said, that the healthcare professionals are a bit nervous, they are a bit skeptical, and likewise the patients are too. And the reason for their nervousness, I can understand, is their data. So how about the data security or the data safety in terms of using AI? And again, I'm aware that probably AI is not HIPAA compliant. Is that correct?
Yeah, I mean, there are HIPAA compliant AI. So we talked about Open Evidence and Glass Health before, both of them HIPAA compliant. There are AI scribes like Freed.ai, which any physician can sign up and try to use. That's also HIPAA compliant. Um, so you have to just understand that the public stuff like Claude's Anthropic and Anthropic Claude, OpenAI, these public GPTs are not HIPAA compliant. That said, they can still be used for clinical decision support. So if you need to, find out something about a certain disease state, go there and ask ChatGPT. It'll be about 98% accurate, right? There may be 2% here and there where it might hallucinate something, but it'll be mostly accurate. Um, one of the things we might talk about education later, but one of the things with education of doctors to use AI is to create the prompt accurately, and then to also know which AI to be used for which for which um, use, right? And with that knowledge, I think doctors can start implementing AI in their practices right away, um, and still not be worried about data privacy or anything like that.
Right. So I think there's something where we do gain confidence, and we are very confident that we are here to stay, is when it comes to medical ethics and the doctor-patient relationship. So when it is said that doctors may be replaced, so then we joke and say it's the radiologist who will lose the job or a pathologist will lose the job, but because they do not have much of that doctor-patient interaction.
Mm-hmm.
But having said that, so what is going to be the reality in the foreseen future? So will that doctor-patient relationship will indeed be lost, even for a physician or a surgeon? And that brings us to the ethical question as to will actually some of the roles that the doctors take part in empathy, in lot of things that are related to medical ethics. So do you think that is going to change in the foreseen future?
Yeah, I think it's a good question, and I think the main thing to understand, right, is that doctors don't have the monopoly on empathy. In fact, a lot of doctors don't have empathy very much with their patients. So it's a big issue because, for example, in the U.S., the because patients don't know anything about medicine or much about medicine, patients use heuristics to determine competence. And those heuristics have nothing to do with medical knowledge, has a lot to do with their relationship with the doctor. So even if a doctor is incompetent, if that doctor is friendly, the patient's unlikely to sue them for a mistake. I mean, that's in the data. So the relationship is very important, but also understand that doctors don't have a monopoly on it. So over here, a lot of patients actually choose to see nurse practitioners or physician's assistants because, generally speaking, they do have better empathy uh, than than the more intellectualized physicians over here. Um, and that's a good thing and a bad thing, right? Um, so to that extent, can AI replace that physical and human connection? I think it can, because all it needs to do is to mimic a human connection. It doesn't actually have to feel the human connection in order for the patient to feel that connection, right? So in the end, I think it's just going to be a cultural change, right? So if patients and users of these AI products themselves feel a connection with that AI and are okay with it from a cultural perspective, then they're okay, then they're fine. We can use AI, and you have seen I mean, we're seeing this change in mental health, right? A lot of mental health pods out there, and patients. I mean, if you look at the data, patients are actually more open with bots than they are with humans because they are less afraid of being judged for their thoughts, right? And things like that. So it's an interesting space. It'll evolve over time. Um, and I'm very interested to see how it'll turn out.
Right. And something else comes to my mind when we talk about AI is the equity. And I know there are advantages
Mm-hmm.
when equity is concerned, but there are lots of disadvantages. Now we know again the AI is deep machine learning, a large language models, and it essentially relies on the data it has learned, correct? So
Yeah,
my question is, obviously,
okay.
it will the data that it has acquired will be very much biased as to where the data has been acquired from.
Yes.
The data that has been acquired in your country, in the US, probably will not be similar or applicable to the place where I'm in Bahrain or in India or in Pakistan. So, and obviously, one of the advantages that I've seen is the language, where you can have a translation, and that becomes a positive point. If a patient is not able to speak a language, a local language, then probably he or she is at a disadvantage. Then, if the
Yes.
language is translated, then probably that disadvantage is removed. So, just I want to hear your version or your views on inequity or equity. You put it anyway.
Yeah. It's he actually brought up two very different points, right? So where AI can increase equity, at the same time it can decrease equity. So let's talk about decreasing equity first and decreasing diversity. Um, I think the thing to understand there is that it's already happening, right? A lot of our, cardiovascular recommendations for years and years came from, the Framingham study, right, which is done on nurses in Boston, and it was being applied to people in Bahrain, right, and people in San Jose over here, and I'm sorry, it doesn't apply. A lot of clinical trials now are being conducted in China and India and things like that. So even that data could be significantly biased, right? So I think, and in terms of AI implementation, I like telling the story because it's funny, right? But Facebook implemented an AI for hiring practices, and they had to take it down because it was extremely biased in only hiring white folks. Uh, and so it has to do with the data that's there, and you know we cannot ignore when AI has a bias or when the data that we train AI with has a bias. Um, we need to treat it just like we would a human, right, who makes those decisions. If a human goes and only hires white people, then yeah, that human is biased, right? And we need to evaluate for it. So I think it's a governance problem, a regulatory problem, on that piece. The other piece where AI can increase equity is exactly what you pointed out: language barriers, conceptual framework barriers between different types of people. AI is very good at translating, right? Um, and we'll get a lot better. Actually consulting with a company now that's looking into doing group translation in group therapy settings with multiple languages being used in the group therapy setting. So I think AI has a massive reach here. And also, it'll allow people in the US, for example, right, to understand people in China, to understand people, elsewhere, um, in their native language, potentially even using the same conceptual framework that we use here. and explain all the cultural differences, right, between the two. There's a significant ability to increase equity as well.
Okay, so I'll just change gears here. Let me just shift the discussion on how AI or artificial intelligence can be utilized in medical education and training.
Mhm. Yeah, I mean, education is kind of near and dear to my heart. It was one of my first papers back over 25 years ago. And uh, the I think AI has a significant uh, impact on education. It's not the reason it's not being used as much is mainly because there's not as much money in education as in other places, right? But if you really think about the impact of AI, education is where I think it's going to have a significant impact. I mean, even now, people are asking ChatGPT to teach them how to do things, recipes, all these different things. But now you can create an agent for your particular course, that acts as a one-on-one tutor for every student in that course, and without having to pay for a one-on-one tutor. Right, which is a big deal because I mean, humans, we don't learn by looking at Excel files and tables and even reading books, right? We learn through experience. We learn through talking to each other. That's how we evolved. Writing is just something we invented, but our brains are not, you know, attuned to that, right? And so I think it's going to have a massive impact in education.
Great. No, good to hear that. And I also like when you mentioned it's probably going to be free,
Yeah.
or almost free, I would say.
Well, the way to make it free is just to buy your own computer. The one I
Right.
have next to me right here has a GPU on it. I'm using it to
Right.
create audiobooks. So
Okay.
the
That's good.
best way to do it.
Okay. Before I move on to the next set of questions, I've got a few more. I would like to ask the audience at this point that if you have any question or questions, then please put them in the chat box. You'll also have the opportunity to ask a question by opening your microphone, but you'll have to press on the raise hand icon prior to that. So moving on. So now let me hear your views, Bhargav, on medical research. I know a lot of work is being done or have been done in pharmaceutical industry using artificial intelligence. So if you can just
Yeah.
run through, just give you an overview as to where we are with the medical research.
Yeah. So there's two pieces to this, right? Number one is the drug discovery piece, right? So drug discovery, historically has been a little bit like throwing darts at a dartboard, right? And for example, you might find a side effect of some other drug that you created also treats this other thing, like hydroxyzine. You can use it for sleep or allergies, right? Um, and with drug discovery, what you can do is you can come in with a known concept of how the biological system works, right, or this disease process works. You can come in with an idea. You have to conceive of an idea potentially of treating the disease process, and now your AI can use that information, look at all the data that's been collected from genetic studies, from microarray studies of cell of the proteins and that the cell is making, and then come up with potential targets for treatment. Number one. Number two, design the drugs to attack those targets. Um, and then score everything, right, to prioritize and then say, okay, I think these are the ones that are most likely going to have, for example, the highest binding capacity to target molecule. Is it going to be correct? No, but neither are humans. I mean, we're not doing that well either. And I think it's going to really reduce the cycle time to get to a drug that actually works. Now, on the trial side, what's very interesting is because of all the power in AI, we can actually create human twins and do virtual clinical trials before even touching a real human patient, right? Um, it's very early right now, right? But to the extent that no, we just need to kind of scale our ability to model a human body, we can do that, and we can potentially do a clinical trial. And going back to the bias and equity question, this is where you can deal with bias, bias and equity, is by having a generic human model that kind of works, right? And so that you don't need to do clinical trials in every single like country. Um, but then, you still need to have the human trials at the end. But the idea is that by the time you get to human trials, you've done all the pre-work and 80% of the time that human trial is going to go through.
That sounds very interesting. And I'm sure the medications or the molecule that they will produce will be much, much larger in number. They'll be more effective and more safer, and they will
Yeah.
work very precisely where they need to work. Okay. Now finally, I'm coming just to the end of our discussion. Then I'll open the floor for questions from the audience. Now, if you can just recommend, or if you can just suggest a few applications or apps which healthcare professionals might find useful to use in their daily practice.
Yeah. Depending on the specialty that you're on, right? AI can be useful or not useful, right? So we talked about open evidence. We talked about Glass Health. Both of them are companies that are focused on clinical decision support. There are others, but those are the two that are sort of the ones that I've seen like work the best. Both can hallucinate, both can cause some, have some errors, but the nice thing about it is that they always have the references right there. So if you're making an important clinical decision, you can easily click on the link and go and check out the actual paper. So basically, these AIs will really reduce that search burden, right? Reduce your need to search through the 100 articles on UpToDate that might, relate to your patient. The other one is that's for clinical decision support. For scribing, the one I found most useful is something called Freed.ai, Freed, and that's a HIPAA compliant platform. You can try it on your phone. It's right there, um, and so it's very easy for anyone anywhere in the world to just try it out in their clinic. Um, the other one that I had a conversation with but haven't tried their application is something called Plaud.ai, or Plaud, and they will actually give you a microphone that you can put on your lapel of your suit. And so that's very easy. I'll probably publish an article at some point with the best healthcare AI tools that doctors can start using right away. But those are the ones that come to mind.
Okay, so at this point, before I go on to the chat box, if anybody would like to, because it's a small audience I can see here, if anybody would like to ask a question, then please press the raise hand icon, and then you can open your microphone and then ask. So I'll just give you 30 seconds to do that. And before I go to the chat box. Dr. Iqbal, do you have a question? A very good evening.
I think you might be on mute.
Dr. Iqbal, please go ahead. You can unmute yourself. No, I think he just typed.
Yeah. Yeah.
So his question is, how can AI help in making a differential diagnosis?
Oh, yeah. So AI is amazing at doing a differential diagnosis. You just need to know how to use it. I think, you know, uh, that differential diagnosis, you have to think about it. It's mainly a search problem, right? So, you have a set of data that you believe is relevant. And as long as you give that AI all that data, it should be able to at least round out your differential diagnosis to just add stuff that maybe you didn't think about before. And that's where it's going to help you. Now, is it going to help you prioritize these different differential diagnoses? I think we're too early for it to do that accurately, but it can do the search for you. It can try to match and can try to say, oh, maybe you should think about this or and this and this, and that's kind of the prompt that you need to give to the AI, right? Is saying, hey, I need help in rounding out my differential diagnosis. This is what I'm thinking about. These are the differential diagnoses that I'm already thinking about, right? And then ask the AI, hey, I need more. Because even telling the AI, hey, what differential diagnosis you are thinking about right now is going to help the AI understand what other stuff you should think about, right? So that's really where it's going to be the most useful.
Right. There are a couple of few questions from one of the audience participants. And the question is, uh, I think it's very similar what we have discussed already, but maybe you can just go through this again. Can AI, which of course is a tool, replace doctors and nurses?
Um, as you pointed out before, about 50% of a nurse's work is administrative, right? And so I think that 50% will go away, right? So maybe we'll need fewer nurses. Um, we currently have worldwide, doctor shortages, right? And then we have, again, worldwide doctor burnout problems. So I think AI is just going to solve those problems. It's not going to replace anyone, but it's just going to solve those problems so that doctors can remain human and don't need to be, monkeys, sitting on an EMR, writing out, notes and billing and doing all these other things.
True, true. Yeah, so in other words, we'll be working in partnership. So
Right.
it actually will complement our work or
Yes.
enhance our work.
Yeah, I wrote a couple of articles a few weeks ago it's called Alice in Wonderland, where Alice is the AI and Wonderland is sort of the place where there's a hospital and things.
Right,
It's a
right.
creative piece, it's a story, but it sort of shows how an AI might be well integrated into the clinical workflow and really assist doctors and patients.
Yeah, it is also said that AI, actually it should not be artificial intelligence, but augmentation intelligence. So all it is doing
Ah,
is
that's interesting. Yes.
augment our work.
Yeah.
Right. There's a question from the same participant. Will AI ever understand our cultures, all the cultures, and deal accordingly? So it's again matter of equity.
Yeah, it has to do with the with training. I'll give you an example that's outside of this, which is in coding, in programming languages, because I'm coder. I tend to do this a lot, and you can think about like different frameworks for creating software as different cultures, and the accuracy of the AI in understanding that different culture is dependent on the amount of context I give it. So for example, uh, I was using LangGraph and LangChain one time. It's not obscure, but for some reason AI just can't do it for some odd reason. So I have a set of documents that I just put inside the code base so that when it generates code, it knows how to generate the code. Um, it uses that as context. So it's the same thing with cultures. I think it requires a human to go in and really understand the culture, or potentially it requires another AI to interact with people in that culture until it understands, until it can summarize the
Right.
cultural differences. Um, and once that's done, then that context can be added to any workflow design for AI use in a healthcare setting or outside of the healthcare setting, for that matter.
Right. I can see there are a couple of questions which have come directly to me, not open. First one is that if I'm a patient, so I'm not sure if this is a patient or a healthcare professional. If I'm a patient, how can I be confident that my data will be kept confidential? And can this be assured before I go on to have a consultation with the doctor who is using AI?
Yeah. So again, this has to do with whether number one, whether there's two pieces of this. Whether your data is stored on a database somewhere, and that database needs to be secured, right? That's the same as if you use a website or use anything else, right? Number two is whether your data is being used to train the AI by some outside party, right? So the reason ChatGPT is not HIPAA compliant, for example, is because when you type in your stuff, it's actually being used to train ChatGPT down the line. So someone is going to look at your prompts, right? Unless you pay them more for the private version, right? So, but when someone comes in and says, "Hey, I'm HIPAA compliant and SOC 2 compliant," right? When that vendor comes in and says, "I'm HIPAA compliant, SOC 2 compliant," it means that they have isolated that data. That data does not leave the um, thing, and in order to say that they're compliant, they have to undergo audit processes, right? So they'll be audited to ensure that. So if your doctor is using AI, we have to make sure that the vendor that they're using is compliant with these security protocols. Now, that said, there's a third part, which is data leakage. And what that means is if another patient calls the doctor and somehow gets your information because that's how the AI was trained, that's a problem. So it's an emerging issue, but there are people starting to address this now because sometimes there is data leakage across accounts within the same system, right? So that's the real question.
Okay, there are a couple of more questions that have come in, but there's one direct question before I move on to those two. I'll just read out. Sounds very interesting, been sent to me directly. Now, in order to continue in my current job, job title is not mentioned. Do you think in the future I'll need to do certain courses or to obtain certain qualifications in artificial intelligence to keep my job? So it depends on which job.
Yeah, I no, I get it, and the moat between people who use artificial intelligence to do their work and the people who don't is going to widen, and the people who use artificial intelligence are going to advance faster than people who don't. On the other hand, you have to use it well. I'll give you an example. At a prior company that I consulted for, one of the executives was whenever I asked him a question, I always got a chat GPT answer back, and I knew the AI model he was using because of the way it was answering my questions, and um, it's because I mean he was just putting my questions straight in chat GPT, not looking at the answer at all, whether it answered my question or even provided an intelligible answer. He just copied and pasted it into Slack, right? That guy got, yeah, I called him out on it and he got fired, right? So just understand that yes, you can use artificial intelligence, but use it wisely. If you're not already good at your job, artificial intelligence is not going to help you. You have to be good at your job, and then AI is going to help you. That I think that's the takeaway from all this.
Definitely. So I think there has to be a good governance and monitoring, and you know. the oversight must be there from a healthcare professional. And as I always say, that AI is there. You adopt it, adapt it, and alight on it, or you leave it and you're left behind.
Yes.
Right. So I'll just, there are a couple of more questions. So I'll take this one. It probably looks like a comment. I think AI will enhance the knowledge for the good readers, but not the skills in practice, especially for the beginners in medical field. So I think it's talking about, she's talking about the the practical knowledge or practical skills that will not be replaced by AI.
As many of you probably know, there are surgery robots out there that can do surgeries, and eventually better image processing. And image processing is still very early on with AI, right? But you've seen this with Tesla, the self-driving and all these things. Um, you know Eventually, yeah, the practical skills can, I think, be replaced by robots powered by AI. But I think we're actually kind of far away on this topic, um, from that actually happening. Um, it's a question of whether AI is actually going to replace that human oversight and human touch, right? That's really where I think we as humans provide the value. Um, I wrote an article about this a little while ago as well, but the AI doesn't have needs of its own, right? All it needs is power and GPUs. As a result, it can't conceive of better. It doesn't do that automatically. We
Right.
have to do that, right? And so that innovation and the adaptability to different situations, that's what makes us human. That's why we survived all these millions of years. And currently AI can't do that. They can't a priori conceive of a better future. You know, it is very parochial in its viewpoint.
Right. Just a couple of more questions. Maybe very briefly we'll go through. Again, probably is the same. Can AI be an aid to us in future, replacing scanning and lab investigations
Um, Replacing scanning. I
and
guess so.
lab?
Yeah, yeah. I mean, again, I think short term, um, over the next 10 years, I think AI is going to be mainly about bringing the relevant information uh, to be in front of you as a clinician. Um, it will be able to do, I mean, we already do this. I mean, even without AI, is to evaluate, lab investigations and see whether, things are abnormal or normal, right? And what the next steps are. Um, so I think AI will be augmenting all of this stuff, right? As we go along.
Right. There's another question. I think we have touched upon this. What about building trust and doctor-patient relationship and making a final ethical or moral judgment?
Um, yeah, I mean it's hard. So with the moral judgment, no, I hope that yeah, I mean the doctors generally shy away from making moral judgments on anything, or should shy away rather. Um, but it's I think AI will also augment the doctor-patient relationship significantly. Um, and to be honest, potentially even replace 80-90% of it, where the patient is primarily interacting with the AI and sometimes interacts with the doctor when they come in for visits, once a year or something. But the way this would occur is that a patient with a chronic disease state would see their physician once a year, get put on a treatment plan, and after that, only see the physician if there's anything new going on. Otherwise, the AI basically executes the treatment plan, which would include calling every week and saying, "Hey, what did you eat for the past week? Did you eat any sugary foods? You're a diabetic, oh, wait, okay. We need to get your A1C ordered. Okay, well, now I'll put the A1C in and then get that A1C done every 3 to 6 months. That's something the AI will end up doing most of the time. And they'll just be seeing the doctor once a year to check on everything. And that's oversight for the treatment plan.
Yeah, I think I see that uh, in a slightly different way. While we have our work, has been taken away, or a lot of burden has been taken away by AI or artificial intelligence, then obviously we have more time with the patient. And a lot of patients, they get put off and they are unhappy and unsatisfied because they claim that doctor has not given them enough time, not even had a
Yes,
few minutes with
correct.
them to talk to them or examine them and so on and so forth. So I believe that may be actually a positive thing that when AI takes away a lot of our burden, and surely the burnout the physicians are undergoing currently, that will be reduced. And of course, doctor will have more time with their patients.
Yes, I mean, we'll be able to go back to 1 hour appointments, from the 15-minute
Exactly.
appointments that we have now.
Right. And let me take just the last question. This looks quite interesting to me, and but it is important, by the way. The question is, can AI be used by hackers for the
Oh
future?
yeah.
Obviously, we
Oh
are
yeah,
talking
for
about
sure.
the things that we already see a lot on the internet.
Yeah,
A lot of
we
scams.
haven't talked about this yet,
Yeah.
but quantum computing is on its way, right? With quantum computing, one wonders whether we can ever encrypt something such that hackers can get at it. It's really it's a question because it becomes a bit of a war between the people who are trying to protect the data and the people who are trying to get at it. And sadly, there's more money in getting at people's data than there is in protecting people's data. And and there's a lot of bad actors. There's North Korea, Russia, China. These are bad state actors going after people's data. These are state actors, right, that are doing the hacking. Not just massive hacker groups. Um, So, I mean, as computing power increases, GPUs increase, yes, I mean, hacking will become a massive issue. It already is a massive issue. You guys probably have heard about Change Healthcare's hack little about what, a year ago now, which exposed millions and no, hundreds of millions of users' data because of that hack. Um, and yeah, I mean, I think it's going to be a big problem, and I'm not entirely sure what the solution is to that uh, right now.
True. Right. I think, Bhargav, we could go on and on. There are a lot of things to discuss, a lot of questions, a lot of queries, a lot of misconceptions, a lot of fear, a lot of nervousness. But perhaps we'll leave it for another session. But in the interest of time, I will have to close here. But before that, I would like to acknowledge your presence on a short notice. I truly, truly am very grateful for your presence, and I'm very thankful for being here. Thank you so much.
Thank you. This was a very enjoyable conversation, and I hope no everyone was informed with it. Follow me, DM me, or DM Syed if you have more questions. We're happy to,
Sure, sure. I put your LinkedIn link in the chat box. Just please verify if it
yeah,
is correct.
always happy to have a conversation.
Yeah. See you, everyone. So, a very good night from here in Bahrain, and have a lovely weekend ahead. Thank you so much. Thank you. Good night.
Thank you.
Thank
Bye
you.
bye.
Bye-bye.